Hello, everyone. Good morning, good afternoon, good evening, whatever it is in your part of the world. My name is Kristen Willard, and I am the Vice President of Education here at GAAPP, and we are so pleased to have you with us today. Before I go further, I just want all participants to know that to hear this in either English or Spanish, be sure to click on the icon that looks like a globe at the bottom of your screen on the control panel, and then choose either English or Spanish. And I'll ask Victor to repeat that in Spanish if he would.
Hola a todo el mundo, muchas gracias por venir, muchas gracias Kristen y muchas gracias Vildana. Por favor, los que sois hispanohablantes, por favor, seleccionar la opción de interpretación en la parte de abajo a la derecha.
Thank you so much, Victor. And thank you to Maria, who is our interpreter today. It will be a wonderful conversation. Just to a little review of the agenda and what you can expect. After this introduction, I will turn it over to my esteemed speaker, Vildana, who will be speaking with us today. We will, after that, have an open Q&A session. So please put questions in the chat. We encourage you to do that. And then we'll wrap up before the hour with just a quick closing and where you can reach out for questions and that type of thing. So without further ado, let us get started. I'd like to introduce to you our speaker today. Her name is Vildana Mujkic. You will hear when she speaks just how passionate she is about advocacy for good and health literacy as well. She is an accomplished social business development manager. She's got a marketing and communications background. She spent more than 15 years of experience in managing and executing all aspects of projects that are related to social good and advocacy. She's a founder of a social telemedicine project. You can look at that at www.clinica, and that's spelled KLINIKA.BA. She's founder and president of the Association of Patients with Allergies, Asthma, and Atopic Dermatitis. There's more. You have to hold on. There's more. She does many things. She's a member of the advisory board of World Patient Alliance and the European Lung Foundation. She is also president of the organizational board of the AAA Congress. I know you'll gather this through the conversation, a great deal about her passion and expertise, but just a few things to note. Of course, advocacy for change. She's an expert in social marketing, communications, health literacy, project management, and team leadership. So please help me to welcome Vildana to today's GAAPP Academy. Thank you so much, Vildana.
Thank you very much, Kristen, for this very warm welcome. And it's my privilege to be part of GAAPP Academy, which I consider as a very important project for patient organizations. So I hope I can contribute with this lecture to all patient organizations in order to improve their advocacy skills.
Wonderful. We're ready for your presentation, and let me know if you need anything.
So I'm sharing the screen. Just a second. So it seems like it is blocked somehow. Just give me a moment.
There we go. I can see it moving. If that, there we go. You're on your title slide now.
Okay. So thank you very much once again. And today we are going to start with the lecture, Bridging the Gap Between Patient Organization, Policymakers, Media, and Healthcare Providers. So today's lecture will cover three very significant areas in patient care gaps, and will define types of gaps in patient care, key factors in successful cooperation between patient organization, policymakers, and healthcare providers, as well as patient engagement. So at this graphical representation, we are talking about gap in care, which is defined as the discrepancy between recommended best practices and the care that's actually provided. So we are very often witnessing long, late, and misdiagnosis. Patient does not follow recommendations that in therapy. That's something that occur as well. Poor access to care in local areas, poor communication between primary care and secondary care. So these are all gaps that should be filled or overcome, but it's also a space that we can work on. So when we talk about patient versus provider perception, there's a survey from 2016 which says that only 35% of patients believe their provider has improved engagement with them. 60% of providers say improving patient engagement has been a top priority, but engaging with healthcare providers continues to be a challenge for 65% of patients. So the top challenges from this survey that we could see, the patients report, were trying to engage with providers include limited office hours, slow response times, and repetitive data entry requirements. So what can we do about this? This is the question that every patient organization can or should answer. So we should help them to help us. How can we do it? So answer is definitely health literacy from many perspectives. And health literacy is ability of patients to find, understand, and use health-related information to make good decisions about their medical care and personal health. So it's not only important that we receive information. We need to hear information, we need to process it, and we need to understood in order to be able to take care about ourselves. When we talk about health literacy, there are different kind of studies, but health literacy that does not apply only to individual patients. It applies to patients' organizations as well, because they're able to improve the position of patients considering the level of their health literacy. So it means that knowing the system where you advocate and work, it's one of the most important things when we talk about health literacy and patient organization. So we have here one American national study about health literacy among adults. So you can, it's based according to population, race, age. So for us as a patient advocates and experts, we need to know our patients. So when we know them, then we can do analysis, and then we can go in that direction when it's about health literacy. So as I mentioned, health literacy is applicable to individuals, to the patients, but also to patient organizations. So knowing the system, the patients is also knowing the system is one of the most important factors when we talk about health literacy. Here you can see some results about the very complex phrases that normally are used with physicians, but our patients are not able to understand them. So patient organizations are the one to be mediators between physicians and between patients in order to translate complex phrases to be able for patients to understand it. So now I'm going to show you one, let's say, funny example from the scene from Dr. House, which reflects to poor health literacy. But before that, we can also describe one example of poor health literacy. For instance, when we talk about medication misunderstanding example. So, for instance, a patient is prescribed medication with instructions to take it twice a day. However, the patient misunderstands and takes both doses at the same time, leading to an overdose or insufficient therapeutic effect. So these are very common situations that happens with patients, and that can be overcome with health literacy. But this is only one pillar, let's say, or one focus that we are going to talk today. So now we're going just to see one funny scene in order to have better understanding of situation that happened, that really happened with patients.
I'm not able to hear it, Vildana. You might just want to reshare with sound.
Well, I went to more and then share sound. So we
in a week.
You sure you're using it?
No.
My asthma. They said they'd fix it, but it didn't make any difference at all.
Well, sometimes doctors make mistakes. Anna, you have to try twice as hard to fix them. Are you using your inhaler?
All the time. Go through one a week.
You sure you're using it right?
Do I look like an idiot?
No. Why don't you show me how your inhaler works?
Jerk.
So this is something that we don't want to happen.
Yeah.
As mentioned in previous slides, this plain language is very important. So we will not say who's the guilty side here, but the most important is that physician is sure that the patient understood what to do. So how to overcome the gap in health literacy? This is one of the solutions, to have easy language when communicating. So as said, key factors in successful cooperation, one of them is definitely learning health policy. So after covering this patient education and health literacy, learning health policy is also one of the very important parts of advocating in advocacy, because without knowing the policy and the system and the country where we operate, we are not able to make bigger change. So you see these stakeholders, we are the part, this is some kind of spinner that goes around policy implementation, and we should be here, and we are here, but we should be more presented in strategy development. That's one of the most important aims and goals that we should all strive together. So knowledge and learning health policy system has, let's say, I define it as a seven benefits. And it can start with effective advocacy. So understanding health policy enables advocates to navigate the healthcare system more, so or effectively, and identify systemic issues and work towards, let's say, meaningful changes that benefit patients. So knowledge of policy helps advocates influence legislation and regulations that impact patient care. So we need to know what stands behind. That's very important. So when we talk about navigating complex systems, health policies govern how care is delivered, funded, and regulated. So just for instance, if you're asking something, if it's not possible within the system that you operate or live, you will be perceived as not that serious. And we all know that we are very serious, that we are patient experts who really change the world and impact the position of patients. So we are able. So it's not before it was time maybe of cute or poor young or it doesn't have to be young, but patient leaders who just asked for help, for short-term help. But now things are changed. We are well educated. We know how to do it. And we need to be respected and perceived as a very important part of this health system. So as a third benefit of knowing the health policy system, I stated improving access to care. So definitely, if we know the health policy system by understanding policies that affect healthcare access, advocates can identify barriers to care and work towards solutions. When we talk about influencing policy change, so knowledgeable advocates can participate in policy discussions, provide testimony, and collaborate on some strategy. That's something that it's really important, and that's something that GAAPP works on it and advocates for very, very hard. So also resource allocation. It's very important to know how budget and resources work. So understanding how resources are allocated within the healthcare system allows advocates to push for fair distribution. This is something that we witness all the time, that one part of diseases or specific diseases get more than others. Very often when we talk about atopic diseases, airway diseases, the one that we are focused in, they're not on the radar. So we have to push harder. So we need to know what stands behind. And definitely enhancing collaboration, because advocates often work with various stakeholders, including healthcare providers and government agencies. So understanding health policy facilitates better communication and collaboration with the entities to achieve common goals. So it means that when you approach to policymakers or governmental institution, you need to know, what do you talk about? Okay, so you need to know exactly what you are asking for. So that's very important. And then you are perceived as a very credible party. And that's something that we want to achieve. And finally, responding to changes is something that happens when you know adequate, let's say, responding to changes is something that happens when you know the system. So healthcare policies are constantly evolving. So advocates who stay informed about policy changes can quickly adapt their strategies and provide, let's say, up-to-date information and support to patients. So it's very important that you build your relations among, and everyone are important in the process. So if you can get information easily, then you can adapt it and you can work around it. So in conclusion, let's say that learning about how policy system empowers patient advocates to be more effective in their roles, in their everyday roles. So it equips them with the knowledge needed to navigate and to influence the healthcare system, what we do on daily basis. So this understanding leads to better health outcomes and more equitable, let's say equitable, healthcare system for all patients. So if we all follow this, we can say that it is important that we educate patients, but it is also important that we educate ourselves about the system in order to be able to make bigger change. So regarding some critical factors and that can be very helpful in building some strategies or projects is something which is called focus on public partners' needs and priorities. So you have to make sure that everyone needs something. Even though we are a patient organization and access to treatment is very often one of our most important things, Ministries, they all, Minister of Health, for instance, he or she also needs something. Media, they need content. So everyone needs something. You just have to define their needs. And when you respond correctly and ethically to their needs, then you're able to meet your own, or it will be much easier to meet your own. Also, engagement by public partner champions, that's something that can be very helpful in bridging the gaps, in building the programs and projects and meeting your goals. Capacity to rapid response to changing health priorities, as already said, is something that can be very important. And I just want to stress long-lasting, trusting relationships. It means that you, as a patient organization, build your profile as a credible, full of integrity patient organization that never omit or do not respect its own principles. And when you are perceived like that, you build long-lasting relationships that will not maybe that should strengthen from year to year, and at the end it will definitely gives you results, and it will benefit your activities and your association. Of course, in every country we have bureaucracy, unstable funding, different political landscape. For instance, Bosnia and Herzegovina has 10 ministries of health just in one part of Bosnia and Herzegovina. So it is very challenging in every country. But trust me, if you just are able to make one good example, it's much easier to scale it and copy paste it to other entities and to other organizations. So patient engagement also is very important here. So it's an essential pillar for good health. Patients should be the part of that, in the middle of that circle that you saw in the slide, in a, where everything should spin around the patient. So that's very important. That's something that we all strive. And when pharma industry tells you you should let us know, you can call us or write us when you see the pipeline, that's too late. When you see the pipeline on their website, that's too late. We are all fighting to be part of strategy development. And that's something that we can achieve only by being well equipped with knowledge. Ending this presentation with a case study with our project that we are so proud of. It's called AAA Congress, dealing with asthma, atopic dermatitis, and allergies. So just wanted to present you how everything started in 2019, where Bosnia and Herzegovina still had very poor access to treatment for atopic disease patients. These patients didn't exist on the radar. Let's say, we would get the answer, it's not the cancer. It will be okay, or something like that. So also what we mapped at that point is that physicians were not interested in education, and patients were treated according to very old and abandoned guidelines, like no testing for allergies, etc., etc. It's not needed. It will pass when kids, for instance, are 5 or 7. So what we did, we said, okay, we have that kind of situation and we need to change it. We should go from different angle. We should bring the most significant knowledge to our physicians in our country to educate them how to treat patients better. So we mapped the most influential physicians at that period. They were pretty old, but they were well-known names, professors who were in retiree at that time. You will see the photo on the next slide. So we wanted to send the message that we want only credible sources, information which rely on science, and we are getting serious. So we started the conference having those 2 names. Then we really developed the best education, and we started immediately partnering with relevant institutions. At that time, it was just one hospital who sent us physician to give the lecture. But we put the logo, and that was only the first conference that ended with support for Ministry of Health, access to omalizumab, epinephrine, and JAK inhibitors. So the first on the left is a photo with those two professors. One of them is Professor Alanda, Professor Ediba Saracevic, and Professor Zehra Dizarevic, that were big names, let's say, in atopic diseases at that point, and they just wanted to help. So we ended the process with a big event and, let's say, a lot of influence, not only to patients, patient organizations, but also to policymakers and relevant media who need relevant content. So in this closing part of presentation, I just want to stress that when we close the gap in patient care, it leads to improve both health and economic outcomes. So in addition to helping improve health equity. So we are patient experts who are able to define essential lists, money that is spent on medicines maybe that are not relevant. So we are also important to say, hello, we should talk, and there is a data saying that we spend, pharmacoeconomic analysis said that we spend much more on something that we don't need or don't use, and we don't have specific medicines. So when we have data, then we can communicate like that. So collaborative practice between patient organization, policymakers, and healthcare providers, when multiple stakeholders work together with patients, families, carers, and communities to deliver the highest quality of care across settings. So that's something that I've already mentioned. So we are all, and we should all be perceived as going to solve a common issue. So even pharma industry, in Bosnia, there is no trust towards pharma industry, but there are also good ones. There are good ones who are strategically oriented to improve patients' life as well. So we should communicate and we should partner with them. And also one suggestion to all patient organizations: be careful with the partnering and be careful with the partners that you work, because it represents you. You should always choose the best, and you should always choose the one with most integrity. So you work with best policymakers, with best pharma industry, with best media, so you choose your partners in order to be perceived as a credible and organization full of integrity. And patient engagement through patient-centric approach is a crucial factor for bridging the gap between healthcare providers and policy makers. So that would be all for this presentation, and I'm happy to answer all of your questions.
Thank you so very much, Vildana, for that excellent presentation. We do have time for Q&A, so please put your questions in the Q&A or the chat box, and we will answer those. I'm going to start with one from the community. The slide that you did about key critical factors and facilitators was really excellent. It can be really daunting, I think, for people who are trying to embark into health policy for the first time and trying to understand that. I'm wondering if you have any tips for where to start about learning your particular country's health policy and what that landscape looks like.
When it's about policy, it is something that every organization need to do it on its own. But what I have to say is that there are a lot of resemblance among systems. So you have to dig. So you have to go to websites. You have to find someone who who is willing to share information with you. There is also some laws on information, so you can use that and say we have right to know. Please let us know, etc., etc. There is no magic trick that you get just everything on presentation, you know. But what is very important is that you go and meet people who are willing to give you information. And in every institution, you have that kind of people. You just go and ask for a meeting. It doesn't have to be minister. It can be just a clerk who can help you to continue digging. So that's the point. But there are some key terminology that every patient organization should understand. That's essential list, that's funding, that these are funds, insurances, you know, participations. These are some kind of terminology that you need to know before you go and ask, because you need to know what to ask. You need to know who funds your medicines. Is the medicine which is in guidelines for your disease, is it registered? That's also very important. They should know what does it mean intervention. You know, you can import as intervention. What does it mean? You know, so those are some kind of terms that they have to understand before they go and they apply or ask for something. You know, so I'm pretty sure if they started the organization and we are all very passionate about changing the position of patients, they will strive and they will try to get that information in order to continue with advocacy.
Yeah, I think those are great points. Making sure that you're doing the research and the legwork, so to speak, so that you're equipped to have those conversations. And then a second point, you're stressing communication, which underlies everything that you talked about today, right? Effective communication, establishing relationships. And I don't know if you'll agree with this, but one of the things I think that can be difficult for people, particularly when they're first starting out, is that they are almost timid or afraid to ask for meetings or to reach out and ask wise people what their experiences are. And it cannot hurt to just send the email or make the call.
Exactly. But what also we need to understand is that every patient organization have, let's say, organic growth, you know? So they start with very small project. We were all very small and we are still very small, you know? We just know more. And that's why we are perceived as bigger. But we are all under capacity. But they start with small project, and then it's a process to get there to start doing some bigger projects involving and partnering with public institution. That's something that will come, but the point is that you have it in your strategy. When you start the organization, the point is that you know that you will get there, and that's the way how you change the position of patients. Everything is important. We have different kind of projects. We work on School of Atopy in clinical centers, asthma school, raising awareness campaigns, free checkups, etc., etc. But if we don't have treatment, adequate treatment, you know, the position of patients when you talk about health is not different that much, you know. So that's why that's very important that we all strive to empower organization to ask and to advocate for systematic change of access to treatment. And that's definitely by involving all stakeholders. So you should be perceived as the one who is mediator between all of them. So you give good content to all of them, credible one. You never, as I'm stressing that all the time, you never betray your own principles. As we discussed before, it's more important to know your no's than to your yeses, because if you want to have like long-lasting relationship or organization, and you know that you can track your impact, you really need to have it strategically defined.
Beautifully said. Thank you so very much, Vildana. I understand from Victor that there is a colleague on the line who has a question or comment. I think you are just muted, Guillermo. We can see that you have your hand raised.
¿Me oyen?
Yes, we can hear you now. You can go ahead. I'm not hearing anything, but we could hear you. So go ahead and ask your question. Okay. We're ready, Guillermo, when you are.
En su conferencia, que es lo de los grupos de apoyo, o sea, la educación continuada a los pacientes. Nosotros en Colombia tenemos un programa de educación a pacientes desde hace 4 años, en donde la razón de ser es educar al paciente y empoderarlo para que conozca todo sobre sus derechos y sus deberes que tiene con el sistema de salud y como paciente. ¿Cuál es el inconveniente? El inconveniente es que no tenemos recursos para poder mantener esos programas. Nosotros hacemos un Congreso Nacional de Pacientes cada año, en donde invitamos más o menos 200 pacientes con dermatitis atópica y sus familiares, sus cuidadores. Llevamos más o menos 7 u 8 expertos, dermatólogos, alergólogos e inmunólogos que van a enseñar y a capacitar al paciente en todas sus inquietudes que tenga. Pero la inconveniente que tenemos es que no tenemos recursos para toda la parte operativa y logística que requiere hacer un evento de estos. Entonces, tenemos las mejores intenciones, conocemos la problemática, sabemos cuál es la solución, pero no tenemos los recursos para ejecutarlos. Entonces, en el papel es muy bonito y se ve un proyecto que realmente es acogedor, pero nosotros somos países emergentes que definitivamente pues no poseemos recursos. En alguna conferencia anterior hablaban, no en este grupo, sino en otro grupo que estoy, de trabajar con el voluntariado. Aquí en Latinoamérica es muy difícil conseguir voluntariado porque las personas quieren ayudar, pero necesitan una retribución económica, porque desafortunadamente el nivel de desempleo es muy alto. Entonces no se puede como en países del primer mundo que hay mucha gente que quiere ser voluntario, que quiere ir a apoyar así sea mediodía, así sea una semana. Aquí no, aquí conseguir voluntariado es muy difícil. Entonces, todos estos programas son muy buenos, todos estos proyectos son excelentes. ¿Cuál es el inconveniente en Latinoamérica? Y lo digo porque soy el líder de una organización en toda Latinoamérica, es la parte de los recursos para poder ejecutar estos programas. Y otra parte que usted hablaba de seleccionar los partners, seleccionarlos con los que vamos a trabajar. Pues desafortunadamente nosotros en Latinoamérica no nos podemos dar ese lujo, porque de entre los pocos que ayudan, nos toca irnos con los 2 o 3 que nos ayudan. Entonces es una problemática bien grande que se debe tener un enfoque diferente. Gracias.
May I?
Please.
Thank you very much. It's very relevant and very good observation, and I completely understand what are you going through. But I would give you the advice. When we talk about the needs, they all have needs, and pharma industry, they also have needs. So we are a patient organization, and I will be very direct and very open. So we are not their number one need to pharma industry. So when you organize patient conference for patients with best physicians, first I have one question: are all patients able to understand this highly scientific presentations? Or I think maybe we as a patient experts are, but patients should get let's say easily defined, translated guidelines that should come from us, because we are the one to educate them. So this is only that I'm talking from our experience. So this is one thing. The second thing, if you organize conference for the physicians as a patient organization in order to educate physicians to treat patients better, you will also.
We can hear her. Yes, we can know. Can you, Christine? I can
yes,
see
I can hear her.
Yes.
I can.
So where did I stop? What did you hear the last?
Maria, are you still unable to hear her? Maybe she's dialing back in. Can you hear me, Maria? But oh, yeah, I
Okay,
think it was. Don't worry at all. We want to make sure that Guillermo gets his translation. So what did you last hear? Oh, it's okay.
Okay, never mind.
No
Don't
worries
worry.
at all,
I'll
please.
just wrap it up for. Don't worry. So the point is that you need to define not only your needs, but the need of the partner or stakeholder within the project. So everything needs to be sustainable. That's the point. And then at one point we just give up because we cannot survive. And it can be very frustrating. So if you're organizing for this specific project that you mentioned, I just want to give advice, or you can take it as our experience. So the need of pharma industry is not, that's not the top high priority to come to your Congress and support 200 patients learning. So that's not their top priority. Do you know what's their priority? They want to meet physicians. So they want to come and meet physicians in order to build their own relations with them. So that's the point. So this is the perspective that we were talking about. So we have different angles of, when you go, you can always achieve the goal. You just change the perspective and you stay, faithful to your principles. That's always very important. So the point is, if you organize for the physicians, then you will get the bigger response from pharma industry. And I also have doubt when we organize very scientific events for our patients, are they able to understand and process all very complex phrases that we're talking about? Or maybe they shouldn't at all. Maybe that's for patient experts. If you're organizing a conference for patient experts, that's something else. But I don't think that you have 200 patient experts, in that area, the same as we don't. So the point is that you find the need that they have in order to be sustainable. And I really welcome what you do, and I congratulate you. And I'm pretty sure that you just don't give up. So if you need some additional advices or tips, so I'll share my contact, and maybe we can talk later on and see if there is some maybe different tailor-made project that you can continue doing and still try to find some funds to continue.
I think that's very helpful. And just one thing I'll add, Vildana, and this probably was the case for you, is that you didn't start out at this size for your conference. I'm sure you started out smaller, or with, sometimes people will do things that are local rather than regional, etc. And you can build as you go, because many of us are starting out in a situation where we don't have the resources to put on a full-scale conference.
Not exactly. Our first conference gathered 250 participants, a mixture of patients, not patient experts, because we now offer, we call patient experts and patient leaders now at our Congress, and they are a very important part of it. But the first conference that we started was mixture of patients and physicians. And we got the response from pharma industry that they're not allowed to present their medicines in front of the patients, just patients, okay? So this is something that we discussed, Kristen, before, was the lean project. You just start and you see what works, what doesn't, and then you have to adapt, you have to be flexible, and you are like learning by doing, and that's the situation here.
Yep, nicely put. I see Victor's hand is up as well. Thank you so much.
But I think Guillermo should come first, because I think Guillermo is replying to Vildana. So Guillermo.
Oh, sorry. Go ahead, please, Guillermo.
Sí, gracias. Sí, entiendo. De pronto no me hice entender bien. Nosotros llevamos 14 años haciendo el Congreso. y el Congreso es para pacientes, dictado por expertos dermatólogos y alergólogos en lenguaje de los pacientes. Y allí no se habla de medicamentos ni nada. Es lo que el paciente muchas veces no entiende durante la consulta. Tenemos en Colombia y en Latinoamérica unos tiempos de consulta entre 15 y 20 minutos para que el médico ausculte, haga examen, pregunte y toda la evolución, que realmente es muy poquito. El paciente por lo generalmente quiere que el médico lo escuche, porque una de las cosas que también nosotros trabajamos aquí es la relación médico-paciente. Y este tipo de congresos también nos sirve para eso, para que los pacientes y los médicos vayan teniendo una relación más íntima, que es lo que no se tiene. Entonces, el evento es dirigido a pacientes en lenguaje de pacientes. Y nosotros llevamos 14 años haciendo el evento cada año y cada año nos llegan más pacientes. Lo que yo les comentaba inicialmente es el problema de la consecución de recursos. ¿Ustedes tienen alguna una idea cómo a nivel internacional nosotros podríamos captar recursos para que esto fuera más productivo y poder llegar a más espacios? Porque lo hacemos en la capital del país. Nos gustaría hacerlo en las provincias para que todos los pacientes del país puedan tener acceso a este tipo de eventos. Gracias.
Should I go, Kristen?
Yes, I was going to say if you want to share, please.
Yeah, so well, first of all, thank you, Vildana, for the session. I have heard this for the second time already, and every time impressed me the same. And thanks everyone for your questions. Just the first comment is regarding something that Guillermo and you have tackled somehow, the volunteer problem, right? This is, I think, something that we need to understand. The millennial generation and after and below, they are the first generation that they are living worse than their parents, including me, including possibly Vildana. We live in worse, we have less money, we have more struggles, we will not be able to buy a house. Our quality of life is diminished, we have our expenses are is difficult in terms of like making the ends meet is so much different than our parents' generation, that they had some security, they could be buy houses and have a living. So it's not like the volunteer, the generations, the millennials and the Gen Z and whoever comes next, they are not generous or kind. It's just like they simply cannot. They cannot afford to not spend every single minute of their time making money. So and this is what it is. So what we have to adapt in this case is every time we make a project, and we do that in GAAPP most of the time, when we make a project, we make sure we budget for everyone who is participating in person to be compensated somehow, a little bit or as much as we can, but this is what we have to do. And I know it's difficult sometimes when we ask budget for pharmaceutical companies, that for them to understand that there is a sustainability charge that we need to add, and human resources, they don't want to hear about that. We have to be creative, but I think we don't have any other chance to budget for human resources every time. And if we cannot budget for that, maybe we have to rethink what kind of event we want to do. I think this is something that I think is a reality that we live now, and that was just a comment. So my question for Vildana, I have the honor to be in your event 2 weeks ago. I don't know, it sounds like yesterday when I was in beautiful Sarajevo. And so we have seen the Ministry of Health making a commitment to bring biologics to the country, to the health system, to the public health system, I mean. So what is the steps between policymaker committing to bring something, like saying something in an event, until that becomes law? How the patient organizations can, because we know there is a long process, right? They will have to bring it to the whatever committee that will come to the Senate or the Congress or whatever. And I know there is the many hoops and loops that the things that have to go until that becomes law years after. So how can patient organizations help to push from the moment that someone that probably have only 2 years left on their term, right? Because in democratic countries, until that becomes law, and making sure that if that person leaves because it's voted out, the commitment perseveres.
Exactly.
Thanks.
Thank you very much for that question. It is very important to know that the only solution that is worth is systematic solution. So if we have one-term solution, it makes not. I mean, it helps short term, but if you want to say that you know did something and it stays and it lasts for all patients, that's something that should be a systematic solution. So what we did, what minister, you know, we were like, you know, making not fun around it, but what minister just promised is something that is just, you know, that happened after the hard work of applying advocacy. So there are procedures where they have to form the boards and commission for writing the programs and guidelines, and that they send it to funds, and then they put it on the essential list. So what we also need to know, that's why if you were listening, the presentation, allocation of budgets and means and resources are very important. So right now we are lucky that we knew that, you know, the June is the month for allocating some means in the budget, in the Ministry of Health, for instance. So now the omalizumab, JAK inhibitors, and epinephrine will be on the list for the first time ever after 30 years. And, you know, it happens now because, you know, we knew for this timing, and so it's always about information, but of course you have to work on it. So what we did, we are partnering now with ministries because we are making their life easier. That's also something that we want to share with our patient organization. You know, they have a lot of job to do. Even if they don't, we believe them that they have. So we said, okay, we will help you. We will give you the programs. We will, you know, copy the GINA guidelines and just translate it in our language if you don't have time, you know, or something like that, because there are different kind of policies, different kind of countries. Is not very in Colombia, you know, maybe it's worse than in Bosnia, and it's not nice in Bosnia as well. So that's the point. You just need to be there, cooperative, and the one who is not making the problem, but you always have solution. Like if you do what we had before, so that was our first letter that we sent to ministries, where we did pharmacoeconomic analysis of essential lists, where we had 5 same inhalators, inhaling topical corticosteroids on the list, completely the same, just different colors and different companies. So we don't want to go deeper. Why? You know, we don't want to go talk about bribery, etc., etc. So we will stop there. But the point is, why? We don't need them, and we don't have, you know, biologics. We don't have epinephrine, something that it's really important. So we said, okay, if we just cut off 2 of them, you know, you will have more money. It will stay in the budget than you know, and we will have access to treatment. So sometimes you really need to learn all the way. That's why there are so great projects, AAPATI or whatever, where you really learn about it. You know, you learn about possibilities. So your question was, sorry for being this wide. So the question was how from the big, you know, how something becomes the law. So this is the process. They already know the steps. They just want to, they just don't have time to do it. So you tell them, okay, we are ready. We will help you with some kind of thing. So this is the thing that happened right now. So this Friday, I'm going to sign the final. It's, I don't know, memo or something. So because we are the part of this group, advisory group, where they're developing the program and guidelines. So they already made the commission and the board for sending the exact name of the medicine to funds, because funds are the one who are paying for it. So we are almost there. And I mean, it's done deal right now. So it is a process, but you just have to know it to be able to execute everything and help.
Wonderful. Thank you so much. I want to be conscious of the time as we're nearing the hour. So let me just ask one more question, Vildana, that maybe you can. I know it would take longer to address it in full, but given that you're a communications expert, if you're working at an organization where people don't necessarily understand that all the components that you talked about today, health and reading, literacy, public policy, etc., if they don't realize their importance and they need to be prioritized, do you have any recommendations for people who are in that situation?
Well, you just have to know your capacities. Okay, so you need to know what is your small goal that need to be fulfilled. So sometimes now maybe we are talking from the bigger perspective, but every association should, if you are starting now, we are addressing patient leaders, and leaders of the patient organization. If they have started the organization, they already have motivation to do something. So first, they need to know their patients. So that's something which is must. And you saw about health literacy, for instance, that assessment, American National Assessment on adults about health literacy. And you could see if we are talking about Caucasians, if we talk about Afro-Americans, if we talk what is the age, etc., etc. So you need to know your audience, and then according to that, you have to develop some measurable strategies, short-term goals, whatever, or plans, and then you will say, okay, after 3 months, after 6 months, we succeeded this. Now we can grow until you come in the phase of professionalism. But there's a great plastic example of every patient organization from at the beginning. We start working everything, we do this, we get fund of 100 euros. Great, let's have a campaign. So we are like full of enthusiasm, everything. But at one point, we see that it doesn't work anymore. We are under capacity, we're not sustainable. And still, we ask ourselves, did we make a change? And then we are in phase of professionalism. And when that comes, then you really need to make tailored strategy for your organization, what you want to do. So I think I don't have like unique answer to this question. Yeah. I cannot hear you.
You're muted, Kristen.
Oh, sorry. I just said that's very helpful. Sorry, because it's not intuitive sometimes. So thank you. I know we are just about to hit the hour. I want to be mindful of time. I want to thank everyone for joining us. The recording of this session will be online. Victor, thank you for joining, as well as Maria. And of course, Vildana, thank you for this wonderful presentation. We look forward to hearing more from you soon. If anyone has any follow-up questions, please feel free to email us at info@gaap.org. Have a wonderful day. Thank you again.
Bye-bye.
Thank you, everyone.
Thank you.
Fala.
Bye.